Hi, everyone. My name is Kristen, and I'm giving this presentation today on Treaty 6 territory, specifically on Beardy's and Okamasa's Cree Nation with the Willow Cree, where I work. If you want to know kind of where that is, it's about an hour north from Saskatoon, Saskatchewan. I just want to say, Caitlin, thank you so much for your presentation. We experienced like the same issues here as well. So I thought your presentation was really awesome. And it's really cool to go next because I feel I have like a more focused one community. There's just good flow of presentation topics, I think. So I completed my practicum with Beardy's and Okamasis and had two main activities. One was applying for additional funding for different community departments like sports and rec and emergency management. We were able to apply for $5.3 million in additional funding, which was very busy, but was really exciting because these are programs that just are chronically underfunded. And then I worked with the health clinic to help them develop an evaluation plan for their programs and services. But really the details about the evaluation plan came together very quickly. Most of my time felt more around conversations about how does the Western medical system show up in our clinic, and how do we make sure we're not perpetuating any harms by access or by conducting this evaluation. So my presentation is called Working Towards Mamawiwitsituin, an evaluation plan for Willow Cree health programs and service delivery. There we go. So Willow Cree Health Services is the community health clinic in Beardy's and Okamasis and has been around since 1979 when it was just a community health nurse and a community health worker. Now we have about 50 employees and offer a wide range of health services, including dental therapy, mental health supports, medical transportation, and quite a bit more. Our mission statement is Mamawiwitsituin, or all working together to help each other. But we feel there's a little bit of a disconnect. We could be doing more. Almost all of our funding we get is from the federal government. So we work within whatever parameters Indigenous Services Canada sets out. And although we evaluate our programs every year for reporting purposes, like Caitlin was saying, they take a lot of information from us. The reporting we do for ISK does not include any meaningful conversations with the community. It's just statistics, and we don't see the results of what we do. So I guess why am I referring to the clinic as our funding and our reporting? I work there and as part of developing this evaluation and just making sure we weren't doing any harms, it was really important for me to identify my positionality. And this has been a really important practice for me within the entire mental health program. So I am a white third generation settler. My family came from Scandinavia, and the Canadian government either gave or sold my family land to farm, which wasn't theirs to give. So I have benefited greatly from the colonization of Canada. And currently I work as a community dietitian at the clinic. It's an interesting position to be in because it only exists because of colonization. There was no record of diabetes prior, and there wasn't food security issues prior to colonization either. And that's mostly where I work in. Something I had to keep in mind while working on the evaluation plan was that next week I go back to work and I will be using the results from this evaluation. But working with my supervisor, we felt it more appropriate that I remove myself from the core stakeholder lens and actually be a student and do more of the suggesting different aspects. But ultimately, it was Willow Cree Health leadership that made the decisions on what the evaluation plan would actually look like. So the idea for this evaluation actually came for one of the previous public health courses that we took. And I asked the health director if this would be something she'd be interested in pursuing, as she had just started, and she agreed. Through our studies, we know that community programs created with the community are more effective, but most of the programs that we have are created by ISK. And while we can get away with a lot, there are still deep-rooted Western ideals that affect us. And I think that's seen by the fact that the community has never been consulted on what they would like to see from the clinic. We don't need it to get funding every year. And we're in a unique position this year as we'll be renewing our funding agreement with ISK. And so we're currently creating a 5-year strategic plan. So it's a very good time to actually do an evaluation. We came up with some principles we wanted to make sure were the focus of this evaluation, to make sure we were gaining knowledge in a safe way. And this is where the bulk of my experience was in having conversations around these guidelines. So even though most of the people that work at Willow Cree Health are from Beardy's and Okomasis, the clinic is still inherently part of the Western healthcare system. And a lot of evaluations in communities are often initiated by organizations where Indigenous peoples receive services, which is exactly the case here. So we wanted to make sure it was absolutely clear to members that participating or not participating did not impact what services they can access from us at all. And they can choose to not consent even after they've participated. It's also incredibly important that knowledge is gained in a culturally safe way. In Beardy's, one protocol for showing respect for knowledge is to offer tobacco or another gift that you think is meaningful, because this signifies that you think the knowledge is important, you understand that knowledge is not free, and you hold the knowledge that person has in high regard. So that's kind of what we tried to incorporate in how we collected data. And the idea of reciprocity, the evaluation must give back to the community in a way that's meaningful for them. The same time I was doing my practicum, there were a couple university studies being conducted in the community from the provincial university here. And it was really interesting to compare what they were doing and what we did not want to do. And if you want to know some of those comparisons, ask me in the question period. So the purpose was to design an evaluation plan of Willow Cree Health programs that really centered community voices to identify which programs are successful or ones that need improvement, what barriers community face in accessing our services, and ways Willow Cree Health can be more community focused. And again, these results will be incorporated into our 5-year strategic plan. The leadership team decided on 3 different ways of gaining knowledge. First would be a paper or a phone survey with 17 questions regarding clinic specifics, with a brochure attached that outlined everything we offer just to jog people's memories. These are questions like, what programs do you currently access? Are you satisfied with them? What can we improve? Do you experience any barriers? And if so, what are they? And do you have any ideas of how we can address them? And things like that. The second were community forums with questions regarding general clinic themes, like how can we improve? What do we do well in the community? And then we wanted to create a space for participants to ask us any questions about the clinic, because there's never been an opportunity, a public opportunity for people to ask us questions about how we do things. And thirdly, to have individual unstructured interviews in person, where we give community members a chance to tell us anything. It can be about what we improve, ways to reform different departments, what health means to them, and where we can try to get to, anything. For data analysis, the clinic felt that using SurveyMonkey was the most appropriate because we don't really have the capacity to do a detailed analysis. And because when we actually do the analysis, I won't be a student anymore. I'll be in my regular role. And funding is an issue for the analysis part. So if we can find funding, then we'll do a more detailed analysis. But right now it's just SurveyMonkey pretty much. Once our findings have been compiled, we plan to host a community event where we'll present our findings and give the community a chance to speak on how they would like us to incorporate the findings into the strategic plan. Then we'll host another community event to present the strategic plan before we send to ISK for final approval. And Willow Creek Health feels that by implementing the strategic plan, that's the reciprocity piece. And as I said before, this is the first time Willow Creek Health has ever sought community feedback. And so we're very excited about the opportunity to actually incorporate feedback into our strategic plan. There'll be limits to what we can incorporate because there are constraints from funding from ISC. But we feel confident that through these results, we'll be able to reduce barriers for accessing our programs and just be more client or community centered in general. There are no plans to share the results of this evaluation with any other organization, but we are prepared to share the methods with other Indigenous health clinics to improve how community members are involved with evaluations. And I'm so grateful for Willow Creek Health for allowing me to work with them on this evaluation plan. Thank you very much for listening.